Welcome to Evidence Mastery with Dr. Masood Tusi. I'm going to help you understand what migraine is and how it is managed. Please note that this video is for education only and will not replace your doctor's advice.
So today, we're diving deep into migraine. Now, it's easy to think of a migraine as just a really bad headache, but the evidence tells us it's so much more than that. It's actually a complex neurological condition, and really understanding what's going on is the absolute first step to managing it effectively.
So here's our game plan. We'll start with the basics. What exactly is a migraine? Then we'll get into the why, the causes, and those pesky triggers. We'll walk through what an attack actually feels like, including something called an aura. After that, we'll cover diagnosis and, importantly, the red flags to watch out for. And finally, we'll talk about management, both for stopping an attack and for preventing them in the first place.
All right, let's get right into it. Section 1. What is a migraine? Let's pin down a clear, evidence-based definition.
From a clinical standpoint, a migraine is an attack that can last anywhere from 4 hours to 3 full days. And the pain isn't just any pain. It's typically a severe, pulsing or throbbing sensation, and it's often, though not always, on just one side of the head. It's this unique kind of pain, plus a whole host of other symptoms we'll get to, that really defines a migraine.
And you should know this is an incredibly common condition. Just look at the numbers in the US. In any given year, about 18% of women will experience migraine. For men, it's about 6%. That means it's 3 times more common in women. The evidence shows us it often starts around puberty or in young adulthood, and for some, the good news is that it can get better after the age of 50.
Okay, so we've established what a migraine is. But the big question is, why does it happen? To answer that, we have to look inside the brain and understand the complex dance between the nervous system and the brain's blood vessels.
The best way to think about migraine is as a neurovascular pain syndrome. That sounds technical, I know, but let's break it down. It's a disorder where the brain's nerve cells, the neurons, start processing things differently. Think of it like a communication mix-up, which then flips a switch on the trigeminal system. That's basically the main pain highway for your head.
So here's how that whole cascade unfolds. It starts deep in the brainstem. An activation there sets off this slow-moving wave of electrical changes across the brain's surface called cortical spreading depression. This wave then irritates that pain highway we just talked about, causing it to release a flood of inflammatory chemicals. And one of these is absolutely key. It's called CGRP. Remember that one, because targeting CGRP has been a massive breakthrough in treatment. All of this leads to inflammation in the blood vessels around the brain, and that's what causes that signature throbbing pain.
So what flips the switch on this whole process? Well, we call those triggers, and they are famously individual. What sets off a migraine for one person might be totally fine for someone else. Some of the usual suspects are things like skipping a meal, not getting enough sleep, stress, or for many women, hormonal shifts during their cycle. The evidence is pretty clear that keeping a diary can be a really powerful tool to help you figure out what your personal triggers are.
Okay, so we've got the science down. Now let's talk about what it actually feels like to go through a migraine attack. It's often not just one single event, but a whole series of phases. For a lot of people, the story doesn't even start with the headache. It can begin hours or even a day before with what's called a prodrome. These are subtle warning signs. Maybe you feel irritable or your neck gets stiff. Then, for about a quarter of people, the next phase is the aura. And only then, after all that, does the main event, the headache phase, usually kick in. Now this aura can sound pretty strange, maybe even a little scary, but the most important thing to know is that these are temporary and completely reversible neurological symptoms. Most of the time they're visual. You might see bright, shimmering zigzag lines or flashing lights. Less often it could be a sensory change, like numbness that slowly creeps up your arm, or even finding it difficult to get your words out for a little while.
And I really can't stress this enough. Migraine is so much more than a headache. It's often a full body experience. During an attack, many people feel nauseous. Your senses go into overdrive. The slightest bit of light can feel blinding, a normal sound can feel deafening, and even faint smells can be overwhelming. This is exactly why so many people have that overwhelming urge to just retreat to a dark, quiet room. So, with this whole collection of symptoms, how does a clinician actually make a diagnosis? Well, for the most part, it's a clinical diagnosis, which means it's all about listening to the patient's story. But, and this is absolutely critical, it's also about being a detective and looking for any red flags that might point to something more serious.
So you really have to know how to separate typical migraine features from these red flags. For example, a thunderclap headache, one that hits its maximum intensity in seconds, that is not a migraine. A brand new type of headache starting after age 50, or a headache with a fever, or one that causes lasting neurological problems, these are all signs that demand immediate medical evaluation, which often includes imaging like an MRI scan.
And the evidence highlights a few common diagnostic pitfalls. For example, a lot of people think they have a sinus headache because they feel pressure in their face, when it's actually migraine. But maybe the most dangerous error is for someone with a history of migraine to just assume that every single headache they get is just another migraine. That complacency could cause them to miss something very serious.
Okay, let's switch gears now and talk about what we can do about it. When it comes to management, the approach is really two-pronged. We have acute strategies, which are all about stopping an attack that's already started, and we have preventative strategies, which are about reducing how often and how severe future attacks are.
So for that first prong, stopping an attack, we have a pretty impressive toolkit these days. It ranges from simple analgesics like NSAIDs for milder attacks, all the way up to migraine-specific medicines. These include the triptans, which are workhorses that target serotonin receptors. And then there are the newest players, the triptans, which, you guessed it, go right after that CGRP molecule we talked about earlier.
Now, the approach here isn't one-size-fits-all. It's often a stepped care approach. For a mild attack, an over-the-counter medication might be all you need. But for moderate to severe attacks, that's when we bring out the big guns, the prescription meds like triptans. And for those really severe, relentless attacks that just won't break, sometimes a trip to an urgent care or emergency room for IV medications is necessary.
And that brings us to our final section, which is all about playing the long game, prevention. The goal here isn't just about surviving attacks, it's about gaining long-term control over the condition to really improve your quality of life.
So who should be thinking about preventative therapy? Well, the evidence suggests a few key scenarios. It's worth considering when attacks are happening frequently or when they're so severe that they're disrupting your life even with good acute treatment. It's also really important if you find yourself reaching for those acute medications more than a couple of days a week, because that can put you at risk for medication overuse headaches.
All right, we have covered a ton of ground today, so let's just boil it down to the 4 key takeaways. Number 1, migraine is a complex brain disorder, not just a headache. Number 2, the diagnosis is based on your story, but it is absolutely essential to rule out those red flags. 3, the best management uses a 2-part strategy, treating acute attacks and preventing future ones. And finally, number 4, never underestimate the power of lifestyle factors like sleep and stress management.
And that quote really gets to the heart of the modern approach to migraine care. Right now, we don't have a cure, but what we do have are incredibly effective ways to control it. The goal is to put you in the driver's seat, to empower you to be an active partner in your own care, and to help you reclaim your life from this condition.
I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel.